Hello, and welcome to today's Cuyahoga County and Board of Health media briefing. Today, we are joined by County Executive Armond Budish, Board of Health Commissioner Terry Allen, Board of Health Director of Epidemiology, Surveillance, and Informatics, Jana Rush, and Metro Health Director of Geriatric Health, Dr. James Campbell. We will begin today by hearing from our county leaders and then end with some questions. With that, I will turn it over to Executive Budish.
Thank you, Devin. Good afternoon, everybody. I'd again like to thank Board of Health Commissioner Terry Allen and his team at the Board of Health for their relentless dedication through this pandemic as they work to keep all of us residents safe. As we move into the fall season, the turning of the leaves and the cooling temperatures provide me with a reminder of where we were this time last year. We were preparing for a second wave of cases, hoping that a vaccine would be coming our way soon. None of us would have known that a year later we'd have multiple options for a COVID vaccine, millions of people fully inoculated, and a booster shot available to many. We've come a long way from a year ago. We've learned a lot, and we've all worked to get through this virus together. While we do see new cases slowing down, I worry about what the coming months will bring. The colder temperatures force many of us inside, and all of us want to see our families over the holidays. These get-togethers can turn into pretty large gatherings. Because of this, last year at this time, our cases skyrocketed, and we saw far too many positive cases, far too many deaths. We now have the chance to prevent this. That's by getting vaccinated. I really don't understand why so many people are resistant to getting the vaccine. I'll remind everyone again, you can find the vaccination location that's nearest to you just by visiting gettheshot.coronavirus.ohio.gov, or you can call 211. For those who have been vaccinated, thank you. You're a large part of the reason we're seeing this decrease in numbers. Now, we've been receiving a lot of questions about vaccine boosters. The FDA has approved booster shots for certain people who got the Pfizer vaccine. You can't mix and match, and the FDA has not yet approved a booster for Moderna or Johnson & Johnson. So this is just for those who got Pfizer. Luckily, the immunity from Moderna doesn't wane as fast as it does for the Pfizer. If you're at least 65 or have certain medical conditions, or you are immunocompromised, and you got your second shot 6 months ago or longer, you're eligible to get the Pfizer booster. The County Board of Health is hosting vaccine booster clinics in October for those who are eligible. On Tuesday, October 19th, the clinic will be at Tri-C's Western Campus Rec Center in Parma. On October 26th, the clinic will be at the Word Church in Warrensville Heights. The addresses for these locations are on your screen. You can register for an appointment at either of these clinics by visiting gettheshot.coronavirus.ohio.gov and searching for these locations. Registration is required. It's required at these locations. So far, we at the county have sent messages to over 4,000 residents who received their first or second dose of Pfizer from the Board of Health. These messages inform them that they may be eligible for the booster. If you know someone who may be eligible, let them know of this opportunity and encourage them to register and to come on out. Now, since we're on the topic of vaccines, I also have to remind everyone that flu season is approaching, just what we need now. And now is a great time to get your flu vaccine. There's no waiting period before or after your COVID vaccination or booster. And if you're not yet vaccinated, please get vaccinated. It can save your life. Thank you. And I'll now turn it over to an old friend of mine, Metro Health Director of Geriatric Health, Dr. Jim Campbell, he's going to talk a little bit about the importance of getting the vaccine booster. Dr. Campbell?
Good afternoon. It's my pleasure to be with you, Executive Budish. And this is a topic near and dear to my heart. Seniors are an incredibly valuable, wonderful part of our community. And they are the people who are the most at risk from coronavirus, and particularly the respiratory illness and potential death from coronavirus. The shot, whether it's the initial vaccine, if you haven't already gotten the initial vaccine, it is definitely not too late to get your initial vaccine. But if you've gotten the initial vaccine and you got the Pfizer vaccine, it's time for that booster. Just like we got boosters when we had our childhood immunizations, just like we get a booster for our flu shot once a year, it's important for you to get that third shot. If you're 6 months out since your second shot, go ahead. As Executive Budish said, you can find it through the website. You can find it through a lot of places. Most pharmacies have it. Most doctors' offices can help you figure out where to get it. I know Metro Health has figured out everybody who got Pfizer, has sent them a message saying if they're eligible or what date, you're eligible for the third shot on November 14th. Please come and get it. It's a chance to help not only yourself, to potentially save your own life, but also to help save the lives of others. It's a chance to protect yourself, your family, and your community. The shot is very, very safe. It has been very, very well studied. And it's a time where we have a chance to really beat this thing. I know we're all a little tired. I know we've been doing this for way longer than any of us hoped we ever would. But it is not time to stop being aggressive about trying to help ourselves and help our community. I'd be glad to field some questions, but I want to turn it over to Commissioner Allen. Thank you.
Thank you very much. First, Executive Budish, for your continued role as our public health ambassador throughout this pandemic response, and your unwavering support for vaccination is very much appreciated, as you've been a champion throughout the pandemic response since we've had vaccine available. I'd also like to thank Dr. Campbell, who has for many decades been a champion of seniors in Cuyahoga County and protecting their health. And so thank you for joining us, Dr. Campbell, and your expertise is welcome. We know the countywide indoor masking advisory issued on September 15th was put in place to blunt the rising surge in COVID-19 cases in Greater Cleveland, driven by the Delta variant. And this masking advisory remains in place because our cases numbers are still high. And of course, other respiratory viruses that impact our community and impacting children at the moment, RSV and parainfluenza, usually not seen until later in the fall, are circulating already in the community over the last few weeks. In addition to COVID, we also face, as you've heard from both Executive Budish and Dr. Campbell, an unpredictable flu season ahead of us. As of last week, Cuyahoga County remained 4 times the threshold for CDC in terms of high transmission, which is the case currently for all 88 counties in Ohio. There's some early indications that things may be improving a bit, and we'll be watching our trends closely and hope that continues to be the case. Unfortunately, area hospitals are reporting that critical care bed use in the community is at 80% of capacity to treat patients who may present with any illness, just as flu season is starting, and their admissions are seasonally known to increase. Hospitals continue to triage patients based on the level of need and are delaying certain procedures because of the COVID surge, and they're also reducing visitation in an attempt to slow things down. Staffing issues have further exacerbated the situation on the ground in these systems, and so we owe all of our healthcare workers a debt of gratitude for their service and commitment to our community and for their strength and perseverance. Here at the Board of Health, our staff continue to soldier on, and their endurance and commitment to service have always been very inspiring to me personally. We'd also like to remind everyone that this indoor masking advisory remains particularly important for the school setting, where cases among students and faculty continue to be high. Cases in the school environment require isolation and quarantine of students and staff to reduce risk. We know that when we have cases and quarantines, it interrupts the in-person education that we know children need so desperately. And the data is clear. If everyone's masked and distanced in the school environment, the need for quarantining is substantially reduced, allowing kids to stay in school and continue to learn. Children's hospitals across Ohio have been treating higher numbers of kids during this Delta surge and continue to urge schools to adopt universal indoor masking requirements to protect kids and families, keep them safe. If we want to keep our schools and workplaces open and prevent more of our residents from getting COVID-19 and ultimately bring an end to this pandemic, we must meet the imperative to vaccinate more people now and embrace universal masking indoor environments when around others. If you're unmasked and unvaccinated indoors and around others, your risk for contracting COVID-19 is very high and will remain so throughout the coming months. On the vaccination front, about 56% of all residents have been fully vaccinated. And in terms of vaccine equity, about 34% of our African American population and 46% of our Hispanic Latinx population are vaccinated fully. Many of us, therefore, remain unvaccinated and vulnerable to contracting and spreading the Delta variant in the community. And we continue to urge everyone over age 12 and older to get vaccinated as soon as they can. Vaccinations are available in many, many places, at hospitals, local health departments, pharmacies, community health centers, you name it. And please remember, the vast majority of the hospitalizations and fatalities from COVID are associated with unvaccinated people. We share community responsibility to protect each other as much as we can and try to prevent the pain and suffering that's been the burden of so many during the COVID-19 pandemic. And we need to protect our hospitals from being overrun by the pandemic and assure that they can continue to treat those who need care. It could be any of us. On the vaccine front, we continue to collaborate with many partners in the community to provide vaccine, first and second dose vaccine at many places. It's by far the leading prevention strategy that can slow and ultimately, we know, end the pandemic. And we know, as we said earlier, vaccines can be found in many places. You go to the gettheshot.coronavirus.ohio.gov website or call 211. The Board of Health continues to offer $100 cash incentive cards for those who receive a first dose at our upcoming Board of Health community clinics. These cards are only for first dose and not second dose or boosters. And the location and dates and times of the clinics that we're holding are available on our website at ccbh.net, which you can see behind me. You choose COVID-19 information from the drop-down menu at the top, and you'll see the clinics are listed there under clinic schedule, and you can go to the community clinics to see our locations. Please sign up on the sites noted earlier if you're seeking first dose, and we encourage you to do so. People with immune system problems, as we've heard earlier, who are compromised moderately or severely, are eligible to receive an additional dose of mRNA COVID-19 vaccine after the initial 2 doses, and this is both for Pfizer and Moderna. And this group represents about 3% of the population. Given their particular risk, they should really contact their doctor and arrange, as Dr. Campbell noted, to get that 3rd dose now. The Ohio Department of Health has released guidance on a subset of the population that's now eligible for boosters. You've heard about this the last time we spoke. Those that received Pfizer are eligible for, if they've received their first and second doses 6 months out. At this time, you cannot receive a Pfizer booster if you received a dose of Moderna or Johnson & Johnson. We'll be waiting to hear what the federal government has to say on that. We'll talk about that in a moment. You're only eligible for Pfizer booster if you receive your second dose of Pfizer at least 6 months prior to the date of the booster clinic. If you're 65 or older or live in a long-term care setting, you're also eligible. And people ages 50 to 64 with underlying medical conditions should receive a booster shot, as well as people age 18 to 49 with medical conditions may receive a booster shot based on their individual risks. We encourage people always to check with your doctor to determine if you qualify. Also, people age 18 and older who are at increased risk for COVID-19 exposure, transmission because of their job, or if they're living in an institution, they may receive a booster shot as well. And so as you heard from Executive Budish, we're going to be holding booster clinics once a week and going through October, November, and December. And we're going to be rotating between, currently between Tri-C West and Word Church in Warrensville Heights, Tri-C West in Parma. And so please go to get the shot. You can also call 833-427-5634. I'll repeat that to schedule a shot, 833-427-5634. There are many places where you can go. And remember, if you go for that booster, bring your vaccine card with you. Remember, as you've heard from Dr. Campbell, boosters are a routine part of several vaccine cycles. When we get a new flu shot every year, which is essentially a booster to combat the flu variants that emerge and circulate around the world for that flu season. Shingles vaccine is like a booster for adults who've had chickenpox, and also for tetanus, you get boosters. The evidence has consistently shown that COVID-19 vaccines are very effective at preventing hospitalizations and death, as unvaccinated people experience both hospitalizations and death at higher rates. And to date, over 6.5 billion doses of COVID-19 have been given around the world. Know the facts and share them with your family and friends, and encourage them to get that first shot. In the coming weeks, FDA and CDC will be considering and reviewing authorization of booster doses for Moderna and Johnson & Johnson vaccine for specific populations. So they'll be going into those deliberations in the coming weeks. We'll also be considering the request from Pfizer for authorization of their vaccine for 5 to 11-year-olds, which we know many parents are waiting for. We'll be tracking those discussions and working with the state health department on guidance related to any of the recommendations that may emerge. Since fall is here and we talked about flu, roll up your sleeve and get that flu shot now. On the testing front, we remind everyone to get tested if you're experiencing COVID-19 symptoms. And we're seeing, of course, the surge in testing volume because of Delta. About 9.3% of residents tested in the county are positive, and that's up from 8.6% just 2 weeks ago. Parents, students, and school faculty administrators, we urge you to go to retail pharmacies to get tested, especially for asymptomatic exposed students and patients. Area libraries are receiving test kits from the state, and you can get them through your area libraries. And hospitals have requested that if you're symptomatic and stable or need a confirmatory test, please go to the outpatient care centers or primary care offices for testing. And do not go to the emergency department for testing. It's important to keep our emergency rooms free to help those most in need. Everyone with a known contact to someone with a confirmed COVID-19 disease should be tested 3 to 5 days after exposure. It's important to isolate if you tested positive for COVID-19 in the prior 10 days, or if you're experiencing COVID-19 symptoms, you should quarantine if you're exposed to someone who's tested positive based on guidance from your local health department. These are proven public health interventions, which are key to stopping the spread. Now, I'd like to offer one word before I finish up on House Bill 244. This was state legislation that was passed a few months back that spoke to actually preventing requirements for vaccines in the school setting, among other things. And so from our standpoint, we know that House Bill 244 is set to actually go into effect. And so from a public health standpoint, any effort to prevent schools and universities that choose to require COVID-19 vaccine to protect their staff and students are counterproductive and only serve to prolong this pandemic. Vaccines are widely proven to prevent the spread of infectious diseases that stand in the way of a child's ability to learn. And they protect against mumps, measles, rubella, diphtheria, tetanus, polio, meningitis, and hepatitis, which are among those vaccines already required in schools. And this makes good sense to vaccinate and protect people. So we would discourage that type of legislation at the state level, which will only prolong pandemics and also serve to exacerbate the spread of other infectious diseases. So I thank you for tuning in. At this point, I'll turn things over to our Director of Epidemiology, Surveillance, and Informatics, Jana Rush. Thanks.
Okay, good afternoon. I will provide some updates on some of the trends that we're currently seeing with COVID-19. So, our current case projections show that our case rates will remain relatively flat over the next 2 weeks. Cuyahoga County is currently ranked 86 out of the 88 counties in Ohio with relation to our case rate. So, we're currently at 400 cases per 100,000 residents. We are still, as Commissioner Allen stated, we are still currently at a high level of transmission throughout the county. And we do encourage mask wearing when indoors and when social distancing is not an option. So, for our cases, our COVID 19 cases are slightly declining within the county. Our 7-day average is currently at 275 cases being reported daily. That's a slight decline of about 10% from early to mid September, when our 7-day average was about 300 cases per day. For our hospital admissions, some of our hospitals are reporting capacity concerns within the Northeast Ohio region. Our adult bed utilization, as Commissioner Allen has stated, is at 80%, and our pediatric bed utilization is at 50%. We are at a 7-day average of about 40 admissions per day being reported for COVID 19 hospitalizations. And the patient census each day is at about 370 patients per day that are currently hospitalized in Cuyahoga County with COVID 19. So, sadly, the total number of deaths for COVID 19 has increased over the past month. And we expected that to happen since our case surge started to happen back in August. So, currently, for all of Cuyahoga County, we've had 2,372 deaths reported to date in the county. Our highest number reported in a single week was in September for this year. So far, we had 16 deaths reported in 1 week. So that's the highest that we saw prior to the surge that started to happen this fall, and that was back in May. So if you recall, back at the beginning of the year, we were at a high surge coming out of the end of 2020. And so we saw that sharp decline in cases over the summer, and now we're back to what we were seeing in deaths back at the beginning of the spring. And currently, we're averaging about 10 deaths per week currently. And so, again, this is more than double of what we were seeing prior to this fall surge occurring. We were less than 5 per week. In some weeks, we had none at all. For testing, we currently are on the incline, almost 10% positivity rate throughout the county. I know that more testing has come online throughout the state, so it's more widely available. So we may expect for that rate to continue to increase as more people seek out testing who are symptomatic. So for vaccinations, we have remained relatively flat as well over the past several weeks for vaccinations. Throughout Cuyahoga County, we're seeing anywhere from 300 up to 1,000 new total vaccinations completed per day throughout the county. And so that just kind of fluctuates day to day, but that trend has been pretty flat. About 55% of the population is currently fully vaccinated throughout the county. Among those that are 20 and older, we know that nearly 50% or more of those age brackets, those 10-year age brackets, are vaccinated, and that increases with age. So, for instance, we're seeing in our 80 and over population, we have more than 75% of that population is currently vaccinated. So that's a good sign that we have people who are most vulnerable. Most of those people are currently vaccinated throughout the county. And then something else that we are currently tracking is in relation to our vaccine breakthrough cases. And so we know that about 90% of our breakthrough cases, those are cases that, as a reminder, that they have completed vaccination. So they're more than 14 days out after their second dose in their series, or first dose if they took a first dose series. And so about 9% of those cases are resulting less than 10%. So 9% of those cases are resulting in hospitalization or death among people who are vaccinated. And over 90% of those vaccine breakthrough cases report symptomatic infection. So we know that we can quickly isolate and do contact tracing with those cases as soon as possible due to the Delta variant. So that's what we're currently seeing in our trends with the data for COVID-19. And I will turn it back over for questions and back over to Commissioner Allen. Thank you.
Thank you all very much for your remarks. We now have a few minutes for some questions. Please state your name and media organization when asking a question, and remember to stay muted when not speaking. So does anyone have any questions?
Hi, this is Anna Huntsman with IdeaStream. Thanks so much for having this today. My question is for Commissioner Allen. Here at IdeaStream, we've been covering the Cleveland mayoral race, and one of the topics that has come up during that time is the future of the city's health department. And an idea that has come across is potentially merging the city's health department with the county. And so I'm curious, are you or have you ever explored this type of merger before with the county and city health department? And where do those plans kind of stand? What's your comment on that?
Hi, Anna. Thanks for your question. So I've been here for, 33 years, I guess, so quite a while. So during that time, from time to time, there have been some discussions about ways that the health department can work together. Of course, we worked together very closely during the COVID response on lead hazard control, a range of outbreaks. We've been doing that for many, many years and collaborate as health departments do across the county, in the region. So these are common collaborations that take place. There have been some discussions about ways that we can work together and partner from time to time over the years, and we look for ways to do that. And that's, I think, been pretty standard over quite a few years since I've been here and worked with many different leaders at the Cleveland Department of Public Health over that time. So yes, these discussions take place. We want to work in a way that best fits the needs of the city and fits the needs of those that we all share in serving here in Cuyahoga County.
Thank you. Have there been discussions about actually merging the two departments? I know you guys work together all the time.
Yeah, we haven't had any of those discussions here. This is not something that any of those discussions have happened, right now or anything being discussed here that we're aware of.
Okay, thank you.
Sure.
Any other questions? All right. Well, thank you very much for your questions. That concludes this week's briefing. Thank you so much for joining us, and we'll see you in a few weeks. Have a great day.
Thank you.
JCPenney's Fall Mystery Sale is here. How much will you save on new fall fashions? You could get an extra 30, 40, or even 50% off with Peel and Reveal coupon. New fall styles, great fall savings. JCPenney.
The time I was 4 years old, really up until I was a junior in high school. There was a short year and a half where in 6th grade I wanted to spend time with my dad.